everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clonidine. Its brand name is Catapres. But before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Clonidine stimulates alpha-2 adrenergic receptors in the brain. This results in reduced sympathetic outflow from the CNS, decreased peripheral resistance, decreased renal vascular resistance, decreased heart rate, as well as blood pressure. The exact mechanism of action of Clonidine in ADHD is currently unknown. In terms of indications for use, as we just mentioned, this medication is indicated to be used in the treatment of ADHD, or attention deficit hyperactivity disorder. It can be used as an adjunct to treat pain associated with cancer. And finally, it can be used to treat hypertension or high blood pressure as well. Before an individual was to use Clonidine or Catapres, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with bleeding diathesis cannot use Clonidine. Medication will be contraindicated in patients who are using anticoagulant therapy. Epidural administration above the C4 dermatome will be contraindicated. If a patient has a hypersensitivity to Clonidine or any other component of the product, they would not be able to use this medication. And finally, it would be contraindicated if somebody has an injection site infection. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. We would want to avoid using Clonidine as first-line therapy to treat hypertension in this population because there's an increased risk of experiencing CNS side effects in this population. And there's also a risk that bradycardia and orthostatic hypotension, which is a drop in blood pressure going from a seated to a standing position, may occur. Patients of all ages, not just the elderly population, should be made aware that bradycardia is a possibility with this medication, and monitoring of bradycardia is recommended. Patients who use this medication who have hypotension or low blood pressure, or patients who have other conditions that may put themselves at an increased risk of developing low blood pressure, should titrate their dose slowly and be monitored. Patients who use this medication who have syncope or who have other conditions that may lead to syncope, such as hypotension, orthostatic hypotension, or bradycardia, should use this medication cautiously and really try to avoid overheating and dehydration. Atrioventricular block greater than the first degree has been reported with the use of Clonidine. Severe bradycardia has been reported in patients who have conduction abnormalities. Monitoring would be recommended, and they would have to do a slow titration with their dose as well. Patients should try their best to avoid alcohol when using Clonidine, as well as other CNS depressants. Patients should avoid drugs that may affect sinus node function, such as calcium channel blockers or beta blockers. The use of oral Clonidine may result in generalized skin reactions. Patients who use Clonidine who require a catheter should be made aware that catheter-related infections have been reported with the use of this medication. Patients should be made aware that somnolence and sedation has been reported with the use of Clonidine. Depression may develop with the use of Clonidine or be exacerbated, so patients should be monitored for signs of depression as well as suicidal thinking or ideation. Initial dose adjustments may have to be made for patients who have renal impairment, and monitoring of these patients would be recommended as well. If somebody is going to undergo surgery, they can use Clonidine up to 4 hours before their surgery and then resume treatment after the surgery is completed. This would be the parameters for the immediate release formulation of Clonidine. Abrupt discontinuation of Clonidine may result in symptoms of withdrawal. So patients may experience headache, tachycardia, agitation, nausea, tightness in the chest, anxiety, tremors, or rebound hypertension. Therefore, a gradual dose reduction is recommended when the medication is to be stopped. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Clonidine, they can expect to receive their dose in tablet form, either immediate or extended release formulation, or they can also receive their dose through an epidural. If somebody is using oral Clonidine to treat their hypertension, they would typically start off with a dose of 0.1 milligrams taken twice daily. The dose could be increased by 0.1 milligrams each week until a maintenance dose of somewhere between 0.2 milligrams and 0.6 milligrams daily is achieved. These daily doses would usually be given in 2 divided doses, one in the morning and one at bedtime. The maximum dose in this situation would be 2.4 milligrams daily. If somebody is treating spasticity, they may use 0.05 milligrams to 0.4 milligrams daily. Again, the dose will be broken up into divided doses, usually given twice daily. If somebody is using an epidural to treat their pain associated with cancer, they can receive a continuous epidural infusion at a rate of 30 micrograms per hour. The dose would then be increased or decreased based on clinical response, and experience with rates over 40 micrograms per hour is limited. If somebody is using Clonidine to treat flashbacks, they may use 0.025 milligrams 3 times daily. They can continue with this dosage for up to 2 to 3 months. For the extended release tablets, it's important that patients are aware not to crush, chew, or alter the tablets in any way when taking their dose. It can be taken with or without food. And when a dose is missed, they should just skip that dose and take the next dose as scheduled. As with all medications, there are some side effects or adverse reactions that patients may experience while using Clonidine or Catapres, so I'll go over some of those here now. Hypotension occurs in about 45% of patients, and orthostatic hypotension is experienced about 32% of the time. About 1 to 5% of patients experience an increase in body temperature. 1 to 10% of patients using oral Clonidine may experience constipation, and about 2.6% of patients using the epidural would experience this side effect. About 5% using oral Clonidine may experience nausea. 6 to 8% may experience a pain in the throat. Upper abdominal pain may occur 12 to 20% of the time. With the epidural, about 13% of patients experience confusion. 3 to 6% using oral Clonidine experience dizziness. And insomnia comes in at a rate of 4 to 6%. 10% of patients using immediate release oral Clonidine experience sedation, and 38% using the extended release experience the same side effect. Somnolence occurs between 19 and 38% of the time. 6 to 9% of patients may experience irritability. 3 to 9% may experience nightmares. Upper respiratory tract infections are seen in 6 to 9% of patients. And fatigue comes in between 13 and 16%. One serious side effect, in terms of cardiovascular side effects, would be atrioventricular block. That's all we're going to talk about today with Clonidine or Catapres. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.